speak about mental health and COVID, a really important area of interest right now. And I've titled my talk, A Prescription for Equity-Oriented Public Health Responses. So I wanted to start off by acknowledging that what I'm presenting today reflects the combined expertise of my research super team. So I wanted to take the opportunity to acknowledge each of them and their contributions. This includes Dr. Anna Gatterman, Dr. Saima Harani, Dr. Antonis Kasoulis, Dr. Corey McAuliffe, Ms. Lisa McGuinness, Mr. Jonathan Morris, Dr. Chris Richardson, and Dr. Kimberly Thompson. And I also wanted to acknowledge Ms. Catherine Jansen and Ms. Margaret Eaton of the Canadian Mental Health Association National Division for their contributions to this work. All right, so starting off, I wanted to provide a bit of background on myself and situate my contributions to the topic. I'm an assistant professor at the School of Nursing at the University of British Columbia. I bring a clinical background in acute mental health and substance use services, which has informed my program of research focused on enhancing mental health and reducing substance use harms for our Canadian populations. My research is characterized by being strengths-based and upstream, which means that I aim to address the root determinants of mental health at a community or population level. To do this, my research is community engaged, and it centers on partnerships with people with lived experience of mental health conditions, as well as relationships with policy and other decision makers to generate responsive and impactful evidence that can inform meaningful action. So now that you know a little bit about me, I'm going to talk about mental health in the context of COVID, including details of a study that I'm currently leading in partnership with the Canadian Mental Health Association and the Mental Health Foundation of the UK. Now, I'm sure everybody has some familiarity with the topic, whether it be through the onslaught of media attention that it has been garnering, or through your own personal experiences of mental health challenge during the pandemic. We have been introduced to a whole host of fear and anxiety in our lives, and many of our pre-COVID stressors have been amplified. You might consider the added strain on those who are already struggling to find or maintain employment or safe and secure housing, or the uncertainty for those who are facing elective surgeries or fertility treatments, for example. Women have been giving birth alone. People have been dying alone. The pandemic has effectively placed lives and livelihoods on hold. Evidence on the population level impacts of the pandemic on our mental health is beginning to amass, and the available data indicates that there's a significant rise in the prevalence of adverse mental health outcomes, whether that be the onset of new worry or experiences of low mood, through to clinically significant experiences of depression, anxiety, suicidal thoughts, and or behaviors. We have some national polling data that has helped to characterize what's going on for people. In April of this year, the Angus Reid Institute released some statistics indicating that half of our population is experiencing worse mental health as opposed to where they were at before the pandemic. 44% of people are endorsing increased feelings of worry. 41% are experiencing feelings of anxiety, and 16% have indicated experiencing symptoms of depression. Now, it's important to note that these are highly elevated over what we would typically expect to see in population data. More recently, in May of this year, Statistics Canada contributed further data that's helping to characterize the mental health impacts, and they've shown that 54% of people are expressing very good or excellent mental health, which is down significantly from 68% in 2018. The mental health consequences of the pandemic are now acknowledged to be one of the greatest imminent concerns, with the numbers of people affected projected to rise dramatically in the short and long term. This is an infographic that's been making the rounds on social media, and I think it's really helpful in illustrating where mental health fits into the COVID timeline, as well as the projected magnitude of this crisis. And what you can see here is that mental health is being identified as the fourth wave of the pandemic. It's responsible for the largest health footprint and is the most enduring. So now that we've established that people's mental health has indeed been severely impacted by COVID, what is really critical to note here, and what the pandemic has so clearly illustrated for us, is that population-level mental health is profoundly influenced by the social determinants of health. These could also be thought of as the everyday conditions in which we live. The social determinants of health include things like our access to resources such as employment and income, safe and secure housing, and social supports, for example. And indeed, the marked increase in mental health challenges amid COVID has been attributed to weeks of physical distancing and isolation, increasing rates of unemployment, economic uncertainty, loss of childcare, housing instability, and food insecurity, to name a few. So now I just wanted to pause for a moment and invite everyone to take a second and reflect on your own experiences during the pandemic. And if you've had, if there's been an impact on your own mental health, to consider the factors that have been shaping your experience. And so hopefully some things have come to mind. I'm confident that for most people, at least one of the social determinants of health, if not several of them, will have been surfaced in this reflection. So this has been the focus of my research for many years, looking at the linkages between the social determinants of health and mental health. And I think the pandemic has offered us an opportunity here to amplify our considerations of these linkages and to move the conversation beyond strictly a biomedical model of understanding of mental health to one that incorporates a mental health promotion lens and related responses. And this fits really well with our understanding of the linkages between the social determinants of health and mental health outcomes. Mental health promotion is oriented at building capacity for mental health and addressing the root causes of poor mental health, such as poverty and unemployment, as I've mentioned. And this ultimately contributes to better living conditions that support positive mental health for everyone. But I also want to point out here that the impacts of COVID have not been distributed equally. Data has highlighted the growing health and social disparities among specific populations and groups. This is particularly so for those who are experiencing structural vulnerability. These are the risks that are imposed by systems of power and oppression that create and maintain sociocultural, economic, and political inequalities. For example, within the COVID pandemic, Indigenous and racialized communities, people who identify as LGBTQ+, and those living in poverty are among the populations disproportionately impacted by the virus. The intersections or experiences of multiple vulnerabilities further compound these inequalities. So given what we know about the profound and enduring impacts of COVID on mental health, as well as the ways in which these impacts are shaped by the social determinants of health, we are in critical need of data that moves beyond the general population impacts and monitors whose mental health is most impacted, how the pandemic is contributing to widening mental health inequities, and what coping strategies or resources are sustaining mental health. My team is currently leading a monitoring study that seeks to address some of these gaps and to provide some critical data to inform real-time, equity-oriented public health and policy responses. To do this, we've assembled a fantastic interdisciplinary and intersectoral team, and I introduced them at the beginning of this presentation. And I highlight it here because its composition represents a critical element of our research process. It provides a team of mental health experts alongside our national mental health partner, the Canadian Mental Health Association, and our global partner, the Mental Health Foundation. This provides direct linkages with policy decision makers with the intention of influencing rapid, data-driven policy and programming responses, as well as facilitating comparisons between and across nations, which has been identified as a key mental health priority in the context of COVID. Our survey items were initially informed by a longitudinal survey first commissioned by the Mental Health Foundation in the UK in March of this year. Original items were guided by the research evidence on the mental health impacts of past pandemics, and then further refined in consultation with people with lived and living experience of mental health conditions, which is a critical element of this work. Items were then modified and additional questions added to reflect the Canadian context, with the aim of examining indicators of mental health among our populations 18 years of age and older, as well as parent or guardian perceptions of the mental health impacts for their children. Emphasis has been placed on including demographic or role and identity questions that will facilitate the identification of the disproportionate impacts of the pandemic on specific populations. So we've just completed our first wave of data collection with at least 2 additional strategic waves planned for the coming months to capture the mental health impacts through the course and aftermath of the pandemic. And our online surveys were distributed by our polling vendor partner, Meru Matchbox, to a nationally representative sample of 3,000 participants across all provinces and territories in Canada. And this took place between May 15th and May 22nd. And this data collection period was selected because it represents the time during which many provinces and territories were moving towards their first phases of reopening following approximately 2 months of physical distancing orders and related disruptions. And while I know many of you are probably eager to hear some of our findings, I don't quite have those ready to share yet, but I do encourage you to stay tuned. I can tell you that we're seeing important differences between priority populations that need to be surfaced and addressed. And as I mentioned, our team is positioned to use these findings to directly inform policy decision makers as well as health system responses. And I think this is so critical because despite what we know about the root causes of the current mental health crisis, the proposed solutions have largely centered on the individual. They've included, for example, ways that people can incorporate mindfulness into their daily lives, or take online courses that are aimed at promoting people's mental well-being. You know, for example, there's a course being offered on happiness. Some of our governments, including our provincial governments, are increasing access to virtual mental health supports. And these are all really, really important measures to be taken, and will provide some relief to some, particularly those who have the personal and social capital to really engage with these resources. But I really want to be clear here. These types of interventions do not fix lost jobs. They do not solve evictions. They do not provide care to children with families who are struggling. And they need to be considered as just one important element within a broader continuum of mental health supports. What we are really needing to see now are collective or policy level interventions operating to safeguard the mental health of our entire population. And we have seen some of this. In response to the economic devastation resulting from COVID, there have been solutions that hold the collective good in mind. The federal government, for example, has launched a series of initiatives to ease financial burdens. These have included things like income subsidies, increased child benefits, food supports. The provincial governments, including the government of British Columbia, where I live, has implemented tax relief and rent supports. And while these interventions are largely framed as economic responses, they're indeed examples of mental health promotion in action. So the question now is, how can these measures or their legacies be maintained to make a sustained contribution to support the mental health of Canadians? And you may ask, how can our governments possibly continue these policy level measures post-pandemic? And my response is, it actually can't afford not to. When last estimated, the costs associated with mental health challenges in Canada topped $51 billion annually, resulting from direct healthcare expenditures, short and long-term disability claims, and diminished quality of life. Our mental health system is widely acknowledged as insufficient to address this demand and is not equipped to respond to the underlying social conditions that are responsible for so many of our struggles. Scientific evidence has long demonstrated the importance of investment into the social determinants of health through a mental health promotion lens. For example, research on programs that help people to return to work or to strengthen parent and families demonstrates substantial financial benefits. On the more intensive end of the spectrum, the provision of housing to people experiencing severe or serious mental illness results in profound cost savings, $42,000 per year per person for those with the highest service use. So these are just a couple of examples that reflect the strong data we have to support policy level interventions through mental health promotion science moving forward. So in conclusion, the pandemic has significantly impacted people's mental health. It has also highlighted that mental health is not simply an individual responsibility. We're not going to be able to expect people to just pull themselves up by their bootstraps or to be treated out of this experience. Mental health is profoundly influenced by the social conditions in which we live. So my hope moving forward is that as a research community, we can lend our expertise and help our colleagues in government to understand the importance of a mental health promotion-based response to mental health in the context of the pandemic and beyond. This is truly a necessary element of a comprehensive mental health strategy that will support our populations as we seek to heal and emerge mentally stronger. So I wanted to thank you for the opportunity to join you today and encourage you to stay tuned for our findings as they come forward in the next week or so.
Thank you so much, Dr. Jenkins. That was fantastic. We've already got a couple of questions popping up. So let's see here. What did you measure longitudinally is our first question from Jinli Wang.
Okay, so we are not measuring longitudinally per se. Our research questions, our survey questions were informed by a longitudinal survey that was first conducted in the UK by the Mental Health Foundation. Our survey represents a repeated cross-sectional design, meaning that we are not going to be resurveying the same people, but rather each time we survey, we will have a new population reflective of our general populations in Canada.
Great. And Ameth Lowe is interested to learn about the variables used in the first wave.
Mm-hmm. So we are looking at a number of different demographic variables, particularly those known to be associated with vulnerability. So we've included things like pre-existing mental health condition, disability status, LGBTQ identity. We are looking at frontline workers, and we're looking at the various categories of frontline work or essential worker status that people have. We're looking at income level and education level, Indigenous identity, identity as a racialized community member. So those are some of the issues that we're interested in. And then we're interested in looking at, we've asked questions around people's mental health experiences. So things with different mental health experiences like anxiety and worry, as well as what they're attributing to these experiences, and looking at the resources that people are using to cope with these experiences, as well as experiences with things like self-harm and suicidal ideation.
You mentioned such an excellent cross-section of people that you're reaching out to, but Linda Ma has a great question. How do you plan to reach out to individuals who may not have access to the internet, such as older adults?
Mm-hmm. So this is absolutely a limitation of the work that we're doing, in that it's a virtually based or online based survey. That is one of the requirements in the context of COVID, is that we're having to shift a lot of the ways that we do our research to make it accessible to people through online mechanisms. The survey company Meru Matchbox that we're working with has a great online existing panel of people that reflect a variety of different kind of circumstances and identities. So we're making sure that we have good representation across the different age brackets and across the different income categories, for example, to help make sure that we're representing and reflective of the populations that we're hoping to serve. I guess one of the other pieces or elements that I could comment on was that our partners in the UK are incorporating what they're calling a citizens jury process. And that means they're going back to people with lived experience, theirs of mental health conditions, but we could go broader than that and look at people, all people who have been impacted by particular vulnerabilities, and make sure that what we're seeing reflects their experiences and their community's experiences, and making sure that the way that we feed this information back to our policymaker partners is based on that information.
And you've slightly commented on this already, but Wendy asks, in the context of the current demonstrations, it's been suggested that some funding from policing be targeted to social determinants of health of marginalized groups. What are your thoughts about that?
Well, that's a great question. I mean, I always endorse our work to be focusing upstream. I think, you know, by the time things get to be a police issue, I think we've failed at a lot of the work that could have been done to prevent us from going in that direction. And so making sure that, you know, we're addressing inequities, that we're responding to these social and structural determinants of health, and making sure that everybody has equitable access to the mental health services they need can help to prevent our need to get into more acute and responsive types of intervention.
Thank you. Kazim asks, you mentioned $51 billion cost imposed on our healthcare system by mental health issues. How much of this cost can be reduced by the interventions that you introduced? For example, the initiatives by the federal government during COVID.
I don't have a straightforward answer to that question, but it's a great one. So that figure was last measured in 2008. And so I think it's safe to say that the projection would likely have increased in recent years. And it was based on complex modeling. So as I mentioned, it's direct healthcare expenditure as well as the costs of disability, both short and long term, as well as the impacts of diminished quality of life. So I think that, you know, again, working to prevent people from having these consequences where you end up relying on very expensive and costly resources in our acute care systems can help to decrease the costs in the long term. The challenge is that it is a long-term game, and it is complex to demonstrate that one thing caused another. So we're, you know, we're working to try and develop methods to be able to measure that and be able to offer policymakers some answers that would be helpful to them. I think one of the other barriers that we experience is that, you know, when working to try and change policy, you know, you're often working with policy cycles which shift and change, and priorities shift and change alongside that. So I think we need to continue to offer our strong quality evidence as it comes out, and to help people to understand that an investment upfront will ultimately contribute to a reduced cost down the line.
Very excellent points. Patty asks, thanks you for this presentation, and asks, are you aware of any programs delivering proactive debrief sessions for healthcare provider groups?
Patty, I don't have a specific answer to your question in terms of what's being offered, but I do know that it's quite clear that people who are working frontline have been disproportionately impacted or are experiencing a significant burden in response to what they're witnessing. And so I will definitely include a focus on that in the work that I'm doing in collaboration with CMHA, who offers services to the public as well as our government partners.
Yes, and Patty follows up and thanks you for the answer, and says this is an area that needs urgent attention from all of us. Given that there are so many people that that either are healthcare providers themselves or otherwise related on the platform, do you have any resources that you recommend for these groups of people?
Could you just repeat the question, because I was distracted by a question that popped up on the screen?
I was just following up on what she was saying. There are so many people that have a healthcare relationship on CanCOVID and might also be healthcare workers themselves. Do you have any resources or recommendations or things that you would point them towards?
Well, you know, for those kinds of direct experiences and trauma that people are experiencing, the Canadian Mental Health Association has a great website. You know, they're a partner on this work, but they also have a bunch of resources that they house that provide online or virtual mental health supports that people can access. So I'd encourage people to take a look there for a start. And then, as I say, we need to make sure that people are supported with, you know, social supports and resources in their communities that help them in their everyday lives.
Thank you so much. Farinaz Havel says, thanks so much for this important work. I'm wondering, do you anticipate the prevalence of mental health problems identified, for example, anxiety, self-harm, that could be underestimated? And if so, do you have any recommendations around reaching those most significantly impacted by mental health problems and overcoming the stigma associated with mental health problems in terms of reporting?
Mm-hmm. Well, you know, I think having an anonymous survey is helpful in getting people feeling comfortable about disclosing what their experiences are, so that we have an understanding of the magnitude of the problem that we're dealing with. And I think that, you know, it's projected that these problems are going to continue to grow in the aftermath of COVID. Can you repeat the last half of that question? Because I did have something related to respond to.
And if so, do you have any recommendations around reaching those most significantly impacted by mental health problems and overcoming the stigma associated with mental health problems in terms of reporting?
Right. So I was just going to comment that I think, you know, if there's a silver lining to this pandemic and the mental health consequences at all, it's been that it has raised people's awareness of everybody, each of our own individual vulnerability to mental health. And it has put mental health on the radar of people who it wouldn't have been, you know, an issue for before. So I think that this gives us an opportunity to continue to try and take action to reduce stigma and to provide those policy level supports for people so that their mental health is protected and promoted, even if they're not in a place to be seeking help directly.
I think that's great, and that's a lovely positive note to end our session on today as we approach our time. Thank you, Dr. Jenkins, for a lovely presentation. Thank you, everyone, for your excellent questions. If anybody would like to review this or share this presentation, it will be appearing on our YouTube channel in both English and French, hopefully within a couple of hours, however long it takes me. Have a good afternoon, and thank you so much for coming.
Thank you.